When the hip replacement started way back in 70s, modern hip replacement, they have been trying for last 200 years, but 70s and all, they started using a cemented hip. Basically what happens, when the bone, you are putting a metal inside a bone, it has to hold or it has to fill up that gap that you have created. So we used to put a bone cement, which is a methyl methacrylate chemically, which binds and also fills up the gap and between the implant and the bone. But it was found that it was causing more problems than anything. So over the period it has developed into uncemented. So now I will tell you three types of hip replacement. One is a cemented type, where you use the cement to fill up the gaps in the bone so that it holds the implant in position. Other is an uncemented. Third is mix and match, where you can do half of it cemented, other half is uncemented, which is called a hybrid hip. So there are three basically, one is uncemented, cemented and hybrid. So now over the period, the materials that allow the bone to grow onto it and hold it, like calcium hydroxyapatite, which is a mineral present in the bone, and we are coating it with it on the implant. So the bone grows inside it and holds the implant long. So these implants, so the one is that now the materials, that is uncemented, has become very popular because the material has improved. Second is that there is a bearing surface where the socket and the ball move on with each other. So this ball and socket joint, over a period they were getting rubbed up within 5 years or 10 years. Now we are using ceramics and also special plastics or ceramics on ceramics. So we call it hard on hard or hard on soft surfaces, which is a very beautiful improvement in the materials that have come up, so that the ball and socket, they last for 20 to 30 years. So we can use the polyethylene plastic we are cross linking it with very highly, we are adding vitamin E to it. So these are the new developments that has happened with the polyethylene, the cup side, and also on the outside of the cup, the material that are almost similar to the bone grows inside and holds it, which is called a tentaculum metal. And also we are using titanium core metals covered with a hydroxyapatite. So this will give a patient, because of the good materials. Now we understood, second thing we understood is the design. The designs of the implant, over a period we studied the biomechanics, lot of papers have come up, and now we are improved the biomechanics, changing the design so that they last 30 years. Third thing is the technique of surgical technique. Now we are doing what we call a minimal invasive surgery, where I do with the hip replacement with cutting only 2 to 3 centimeters, and the patient, imagine a hip replacement done through 1.5 to 2 inches cut, and the patient can walk next day, do everything that he was, and it is painless. So this is the 3 improvements that have happened over the period in hip replacement.